Welcome everyone today to our talk on cardiovascular remote monitoring. My name is Aimee Stefanski and I'm a clinical nurse practitioner at Yale New Haven Health. And I work to lead the remote monitoring team with my friend, Dr. Grubman, who is going to talk to us today about electrophysiology and the aspects and functions of remote monitoring.
Thank you, Aimee. My name is Eric Grubman. I am a cardiac electrophysiologist at Yale. It's a mouthful, but I'm a heart rhythm cardiologist. And Aimee and I take care of patients with heart rhythm disturbances. Sometimes people's hearts go too fast and they need a defibrillator or an ablation procedure, or they go too slow and the patients need a pacemaker. Now, in the early 1970s, my grandfather had a pacemaker implanted because his heart was going too slowly intermittently and he kept fainting. The pacemaker worked great and he never fainted again. The doctors didn't know very much about how the pacemaker was functioning or how his heart was working. They just knew that he stopped fainting. There have been tremendous advances in our field since that time. So currently, pacemakers and defibrillators are able to keep the hearts going at the right rates, but also can record a tremendous amount of information, and they can send that information to Aimee and myself so that we can help take care of patients where they live as opposed to in the hospital. Aimee can talk more about how these devices are implanted.
So when Eric and his team and his colleagues find patients that are candidates for these devices, he brings them into the hospital and does a procedure where he can implant these types of devices into the chest wall. As you can see, they kind of look a little bit bulky. And right after the procedure, you do see that the chest wall is a bit swollen, but about 6 months into it, everything settles in and they are very, very close to normal. Once the device is implanted, though, we quickly act as an electrophysiology remote monitoring team and clinic to make sure that you are connected with your home monitor. There are different home monitors depending on the device that you get, and we have them and are able to give instructions in order for you to stay connected. Outside of these hardware bulky devices, they also now have apps that are on your phone that can keep you connected so that we can monitor you wherever you are and wherever you go. Our team sits and is able to triage arrhythmias and different heart rhythms as they come in. And depending on what we see or actually what you feel, we're able to communicate with your providers and make sure that we're giving you the best care that we can.
So unlike my grandfather, who had to go into the office 4 times a year to make sure that everything was okay with his pacemaker, our patients today could expect to show up in the office probably once a year. However, we are monitoring their heart rhythm throughout the year, and we are able to find problems very quickly when they occur and hopefully head them off before they cause a real problem for the patient. In addition, the monitoring part of the devices has really expanded to allow us to put monitors in patients, either monitors that you would wear on your chest or in some circumstances, monitors that get implanted under the skin. And these can monitor people who we're not sure have heart rhythm problems, but their symptoms sound suspicious to us. And again, we're able to monitor those patients remotely so that you can go about your life and really lead a normal life while we're working on making sure that your heart rhythm stays safe.
These type of monitoring devices that can get implanted for diagnostic purposes or for purposes for us to try to figure out what's going on requires special communication between and relationship between your healthcare workers, your healthcare providers, and the patients. The patients who receive these devices have to stay connected, so have to keep those apps on and have to be available if, in fact, we do see something. And the healthcare providers are responsible for looking and working as a team to determine what type of arrhythmias are going on and if they're associated with any of the symptoms that the patient's having.
So with all of these devices in place, our patients are able to go on vacation. They're able to get medical procedures. They're able to really lead a normal life, knowing that Aimee and I and our team are watching and keeping track and making sure that there are no rhythm problems on the horizon.
I hope that this has been an educational lesson with regards to cardiovascular remote monitoring and the evolution that we've been working very hard to stay on top of. We monitor over 8,000 patients here with these type of devices and have a pretty intricate system to keep everybody connected and to make sure that we continue to have these conversations.